Hi folks, Dr. Ed Beyer here. Today we're discussing the 22 different ways that thyroid expression can be low. 22 causes that are in the scientific literature. I don't make this stuff up. I wish I discovered it, but I've learned about it, okay? So in the scientific literature, we know that there are 22 different ways that our thyroid function can go low, and traditional medicine looks at one of them. This is why I have my clinic full of people, mostly female, that are gaining weight, losing their hair, need extra sleep, or they don't sleep, they're depressed, poor digestive function, they're inflamed, they're miserable, they're in pain, because traditional medicine doesn't look at the why. With functional medicine, which is what I practice, we do. And that's why I'm making these videos, to give people hope. Hey, once we identify these different causes, and most of my patients have more than one. They usually have 4 or 5 different forms of these 22 patterns of low thyroid. Once we identify them and remove them, they get their health back relatively quick. Dopamine regulates the conversion of the inactive form T4 over to the active form T3. Now, in the thyroid gland, when the thyroid gland produces the thyroid hormone, over 90% of that is T4, but that T4 is inactive. The body really can't use it. And so, or if someone's taking levothyroxine or Synthroid, that's T4. And the doctor is assuming it's getting converted over to T3, but there are many causes of that would stop that from happening. There's an enzyme that does that, and there are many things that shut down that enzyme, and low dopamine is one of them. So low dopamine leads to poor T4 to T3 conversion and low thyroid expression. One of the common causes of low dopamine is people that are on this medication, bupropion or Wellbutrin, which causes elevated levels of dopamine, and then the tissues get desensitized to the low dopamine, so it's as if the dopamine is low. So that would be like dopamine resistance. Other medications that are used in excess that would deplete dopamine levels would be a lot of the ADD, especially the ADHD medications like Adderall and Ritalin, and Concerta, and Focalin, and Metadate. The recreational drugs, cocaine, MDMA, amphetamines, heroin, Requip, which is a common dopamine agonist given for restless leg syndrome, and different antipsychotics will all deplete the brain and body of dopamine, causing low thyroid expression. Other causes of low dopamine: poor blood sugar, insulin surges, caffeine, alcohol, smoking, deficiencies in protein, especially the amino acid tyrosine, which is the precursor to dopamine, B6, B9, selenium, iron, and zinc. These are all needed to make dopamine. So if we're depleted in them, then we won't be able to make dopamine levels. And then early Parkinson's or neurodegeneration or advanced Parkinson's. Parkinson's is a neurodegenerative disease where the substantia nigra, a clump of neurons in our midbrain, our mesencephalon, which is where dopamine is manufactured, those neurons are degenerating. That's another cause of low dopamine. Symptoms of low dopamine are depression. People can't handle stress. They can't juggle more than one ball. Life becomes overwhelming. Lack of motivation. They don't enjoy things that they used to enjoy. Fatigue, mood swings, ADHD, low sex drive. They can't finish tasks. And people that suffer from addictions. See, addictions, when an addict is involved in whatever the addiction is, that raises dopamines, and they like that. So addictions will deplete our brain and body of dopamine. So dopamine is an important neurotransmitter in the brain, but it's also a reason for low thyroid expression in that it stops the conversion of inactive T4 over to active T3. So I'm Dr. Ed Beyer. Hope that helps. Have a great day.